patient I had, he was actually a nurse, and I had been treating him for about 8 years. I used all different drugs and antidepressants to try to help get his depression under control because it was pretty severe. And he would get better for a short period of time, but then the medicine would strangely peter out. We both knew, because he was a nurse, that it was probably the placebo effect that he was feeling, not the actual medicine. So he got really frustrated and ultimately had to go out on disability due to his depression. Luckily, TMS came around at that time, and we did TMS on him, and he got 100% better with the TMS treatment. But TMS was super expensive at the time. Insurance didn't pay for it. So he really couldn't do the maintenance treatments that we need to do with TMS to keep his depression at bay. Well, then the DNA testing came out, and he said, please test me. I want to figure out, is there a reason that I failed all the other antidepressants? And it turns out that he was a poor metabolizer of 2D6, and he was a poor metabolizer of the 3A4, which basically eliminates all but one drug that we had tried in 8 years that I was treating him. So that drug happened to be NSAM, which is, of course, an MAOI inhibitor. It is a patch, and we put that patch on him, and his depression went away, and for good. He's in full remission still to date and was able to go back to work.
Wow. That's incredible. And, it's just interesting because, from, my perspective, to be honest, when it comes to like something like CYP3A4 and CYP2D6, when you have a genetic variant for either of those or both of them, you're really impacting nearly 70%, 70 to 75% of the most commonly prescribed antidepressants.